The night shift at Providence General smells like antiseptic and exhaustion. Fluorescent lights hum overhead, casting pale shadows across the empty corridor. Third floor, intensive care. The clock on the wall reads 3:47 a.m. Sarah Mercer pushes a supply cart down the hallway. Rubber wheels squeak against linoleum. She wears gray scrubs, no name badge, hair pulled back in a tight bun. 42 years old, 5'6", lean. The kind of woman people look past without seeing. She stops outside ICU room 12, restocks the glove dispensers, counts gauze packs, checks IV poles for stability. Her hands move efficiently. Muscle memory from somewhere else, some other life. A nurse brushes past her shoulder without a word. Sarah steps aside, says nothing. The nurse disappears into the break room. The door swings shut. Sarah continues down the hall. She pauses at the crash cart, eyes scanning the contents. Epinephrine, atropine, ambu bag, everything in place. Her fingers hover over the airway kit for half a second longer than necessary. She moves on. At the nurse station, 2 residents lean against the counter, coffee cups in hand. Voices low, but not low enough. The younger one, male, late 20s, glances towards Sarah. "Did you see they hired another tech?" The other, a woman with tired eyes, shrugs. "The quiet one? Yeah. Weird, she never talks. Probably doesn't speak English." They laugh, soft, casual cruelty. Sarah walks past them, empties the biohazard bin, replaces the liner. Neither of them looks at her. She takes the bin to the disposal room, seals it, washes her hands. The water runs hot. She watches it swirl down the drain. Her reflection stares back from the metal paper towel dispenser. Pale, hollow, a stranger. She dries her hands, returns to the floor. Room 8. An elderly man sleeps, oxygen cannula in place. The monitor beeps steadily. Sarah checks the tubing. It's kinked near the bed rail. She adjusts it. Airflow resumes properly. She turns to leave. "Hey." A nurse stands in the doorway. Janet, late 20s, sharp voice, sharper eyes. "Don't touch the equipment." Sarah withdraws her hand. The tubing was, "I don't care. That's not your job." Sarah nods, steps back. Janet walks to the bedside, sees the tubing. Fixed. Her jaw tightens, but she says nothing. Sarah leaves. In the hallway, she leans against the wall. Breathes. Her hand slips into her pocket. Finds something small. Metal, worn smooth by years of handling. A challenge coin. The inscription is faded, but she knows it by heart. 160th SOAR. Night Stalkers Don't Quit. She closes her fist around it. The edges press into her palm. Somewhere down the hall, a monitor alarms. Footsteps rush past. Voices rise and fall. The alarm stops. Sarah opens her hand, looks at the coin, puts it back in her pocket. She picks up the supply cart, keeps moving. The break room is empty when she enters. She sits at the small table in the corner, pulls a protein bar from her bag, unwraps it slowly, takes a bite, chews without tasting. The door opens. A paramedic walks in. Kyle, mid-30s, solid build, kind face. He's been working here longer than she has. He nods at her. She nods back. He pours coffee from the pot. The liquid is thick, almost black. He takes a sip, winces. "Long night," he says. "Yeah." He glances at her, studies her for a moment. "You prior service?" Sarah's eyes flick up. Her face doesn't change. "Why do you ask?" Kyle shrugs. "The way you stand, move. My brother was infantry. You got the same. Look." She takes another bite of the protein bar. Doesn't answer. Kyle waits. Then he smiles. Small. Respectful. "It's cool. Thanks for your service." He leaves. Sarah sits alone, finishes the bar. Drinks water from a plastic bottle. The room is silent except for the hum of the refrigerator. She stands, throws the wrapper away, walks back into the corridor. Kyle is at the nurse station now, talking to one of the residents. He glances towards Sarah as she passes. His brow furrows slightly. Something doesn't add up in his mind, but he doesn't say anything. Sarah heads to the supply room, unlocks the door, steps inside. Shelves stacked with boxes, syringes, bandages, saline bags. She begins restocking her cart. Her hands move quickly, too quickly. She catches herself, slows down. On the middle shelf, a cat tourniquet. Combat application model. Black nylon. Velcro strap. She stares at it. Her vision shifts. The walls fall away. Desert. Night. Dust in the air. A soldier on the ground, leg torn open, blood pooling black in the sand. Her hands on his thigh, tourniquet tight, twisting the windlass. His screams. Rotors overhead. Radio static. Stay with me, Garcia. Stay with me. She blinks. The supply room returns. Fluorescent light. Concrete floor. Silence. Sarah closes the cabinet, locks it, pushes the cart back into the hallway. A monitor beeps steadily, in the distance. Footsteps echo from another wing. The hospital breathes around her, alive in its own mechanical way. She walks to the far end of the corridor, begins wiping down the handrails. One section at a time, methodical, invisible. A doctor passes, doesn't acknowledge her. A visitor walks by, face drawn with worry, doesn't see her. Sarah works in silence. The night stretches on. The clock ticks toward 4 a.m. She finishes the handrails, moves to the windows, wipes the glass. Her reflection appears and disappears with each stroke. Somewhere inside her, a voice whispers, "You used to save lives." She keeps wiping. "Now you clean floors." Her hand pauses, just for a second. Then she continues. The halls are empty now. Most of the staff are in the break room or catching sleep in the on-call rooms. The hospital settles into its quietest hours. Sarah pushes her cart toward the elevators. Her shift ends at 6. 2 more hours. She'll go home. Sleep for 4 hours. Come back tomorrow night. Invisible. The smell hits her first. Disinfectant. Sharp. Chemical. But underneath it, something else. Copper. Dust. Heat. Sarah stands in the supply closet, stocking trauma dressings. Her hands freeze mid-reach. The fluorescent light flickers once. Twice. For a moment, she's not in Providence General anymore. She's in a tent. Canvas walls. 115 degrees. Sand in her teeth. Blood on her gloves. A soldier on the table. Chest open. Art visible, beating too fast, too weak. Her hands inside his ribcage. Voices shouting. Mortar fire in the distance. We're losing him. Her vision blurs. She blinks hard. The supply closet returns. Concrete walls. Cool air. Silence. Sarah exhales slowly. Her hands are shaking. She presses them flat against the shelf until they stop. She finishes stocking, closes the cabinet, locks it, walks back into the hallway. The ICU is quieter now. 4:23 a.m. The shift change is still 2 hours away. Most of the patients are asleep. Monitors beep in steady rhythm. Sarah pushes her cart toward the nurse station. Janet is there, typing notes into a computer. She doesn't look up. Sarah empties the trash bin beside. Eyed the desk, replaces the liner. A phone rings. Janet answers, listens, hangs up. Room 14 needs vitals, she says, to no one in particular. Another nurse, older, walks past. I'll get it. Sarah moves to the next bin. Janet finally glances at her. You're very thorough. It's not a compliment, it's an observation. Flat, suspicious. Sarah doesn't reply. She ties off the bag, moves on. As she walks away, she hears Janet mutter to the other nurse. She's weird, too quiet. Maybe she's just shy. No, it's something else. Sarah keeps walking. She's heard worse. At the end of the hallway, she pauses by a window. Outside, the city is dark except for scattered streetlights. A few cars move on distant roads. The world sleeps. She rests her hand on the windowsill. Her reflection stares back. Thin, pale, tired. She used to look different. Stronger, certain. That was before Helmand Province. Before tonight, she lost 6 soldiers in 4 hours. Before she came home and realized she couldn't stay in the uniform anymore. She turns away from the window. Room 9. The door is half open. Inside, a young man sleeps. Mid-20s. Gunshot wound to the shoulder. Gang violence. Stable now. Sarah steps inside quietly, checks the IV line. It's running correctly. She adjusts the blanket that slipped off his arm. He stirs, opens his eyes, sees her. You a nurse? His voice is groggy. No, just checking on you. He nods. Closes his eyes again. Sarah leaves. In the hallway, Kyle is walking toward her. He's holding a clipboard, sees her, stops. Hey, Sarah, right? She nods. Can I ask you something? She waits. That thing earlier, when you said the oxygen line was kinked, how'd you know? You weren't even in the room. Sarah's face stays neutral. I heard the flow rate change. Kyle tilts his head. From the hallway? Yeah. He studies her. Not accusatory, just curious. That's pretty sharp. She shrugs. I pay attention. Clearly. A pause. Kyle shifts the clipboard to his other hand. You ever think about doing more than tech work? You'd make a good nurse. I'm fine where I am. Yeah, but I'm fine. Her tone doesn't change, but something in her eyes does. Kyle catches it. He nods. All right, just saying. He walks past her. Sarah stands still for a moment, then continues her rounds. She heads to the trauma bay. It's empty now. Clean, quiet. Earlier tonight, there was a code here. A man with a stab wound. He survived. Barely. Sarah walks to the supply cabinet, opens it. Inside, neatly arranged, are the tools of emergency medicine. Scalpels, hemostats, chest tubes, intubation kits. Her hand reaches for a 14-gauge needle. She holds it between her fingers, turns it slowly. She's used this exact type before, hundreds of times, in Kandahar, in Helmand, in places whose names she's tried to forget. Needle decompression, second intercostal space, mid-clavicular line. Release the pressure. Let them breathe. She places the needle back in its tray, closes the cabinet, turns to leave. Kyle is standing in the doorway. Didn't mean to startle you, he says. Sarah's posture doesn't change, but her eyes sharpen. You didn't. He steps inside, looks around the bay. You spend a lot of time in here. I restock supplies. Yeah, but you look at things. Like you're, I don't know, memorizing them. Sarah says nothing. Kyle crosses his arms. Not aggressive. Just thoughtful. My brother used to do that. After he got back from Iraq, he'd walk into a room and scan it. Every exit. Every object. He said it was habit. Your brother sounds smart. He was. Kyle's voice softens. He died 2 years ago. Suicide. Silence. Sarah's expression doesn't change, but something in her chest tightens. I'm sorry, she says quietly. Kyle nods. Yeah, me too. He looks at her for a long moment. Then he steps back. Anyway, just wanted to say, if you ever need someone to talk to, I get it. He leaves. Sarah stands alone in the trauma bay. The lights hum above her. The air is cool and sterile. She reaches into her pocket, pulls out the challenge coin, runs her thumb over the inscription. Night Stalkers don't quit. She used to believe that, used to live it. Every mission, every soldier, every impossible situation, but she did quit. She walked away, changed her name on the application, took the lowest position available, hid, because the alternative was remembering, and remembering meant feeling, and feeling meant breaking. She puts the coin back, picks up her cart, keeps moving. The rest of the shift passes slowly. She restocks. She cleans. She stays invisible. At 5:40 a.m., she clocks out, walks to the parking lot. Her truck is old, scratched paint, rusty bumper. It starts on the third try. She drives home in silence. No radio, no music, just the hum of the engine and the sound of tires on asphalt. Her apartment is small, 1 bedroom, minimal furniture, no photos on the walls. She showers, changes into sweatpants and a t-shirt, lies down on the bed, closes her eyes. Sleep doesn't come easily, it never does. Instead, she sees faces, soldiers, young, scared, broken. She sees her hands covered in blood, hears the sound of rotors, feels the heat of the desert sun. She opens her eyes, stares at the ceiling. The coin is on the nightstand. She reaches for it, holds it in her palm. You don't get to quit, a voice whispers. Not really. She squeezes the coin tightly, then places it back on the nightstand, turns onto her side, and waits for morning. The call comes in at 11:34 p.m. Multi-vehicle pileup on Interstate 40. 5 victims inbound. 2 critical. The ER erupts into controlled chaos. Nurses sprint down hallways. Doctors pull on trauma gowns. Techs wheel gurneys into position. Radios crackle with updates from the ambulances. Sarah is restocking the supply closet when she hears the overhead announcement. Trauma alert. All available personnel to the ER. She steps into the hallway, watches the movement, the urgency. No one looks at her. She returns to her cart, continues working. This isn't her world anymore. The first ambulance arrives. Sirens wail. Doors fly open. Paramedics rush a gurney through the automatic doors. A woman, 30-something, head lack, fractured ribs, conscious, screaming. The second ambulance pulls in 30 seconds later. This one is different. The paramedics move faster. Their faces are tighter. One of them is doing chest compressions as they roll the gurney inside. A man, mid-20s, pale, blood-soaked shirt. Kyle is with them. He's calling out vitals. BP, 70/40, pulse thready, chest wound, left side, decreased breath sounds, possible pneumothorax. They wheel him into trauma bay 2. Sarah is in the hallway, 30 feet away. She hears everything. She stops moving. Her hands tighten on the handle of the cart. Inside the trauma bay, the team swarms the patient. Dr. Hammond is the attending. 45, competent on paper, nervous under pressure. "Get me a chest tube kit," he barks. A nurse ends it to him. Sarah moves closer. Not inside the room, just near the door. Watching. The monitor screams. Blood pressure dropping. Oxygen saturation at 84%. Hammond fumbles with the kit. His hands shake. The sterile packaging tears awkwardly. "Doctor, he's decompensating," a nurse says. Her voice is tight. "I know." Hammond preps the insertion site. Alcohol swab. Lidocaine. But his movements are slow, unsure. The patient gasps. Shallow, rapid. His chest rises unevenly. Sarah's eyes lock on him. She sees it immediately. Tracheal deviation. Neck veins distended. Tension pneumothorax. He doesn't need a chest tube yet. He needs a needle decompression, now. She takes a step forward. Janet appears beside her, blocks the doorway. "You can't be in here." Sarah doesn't look at her. His trachea is deviated. He needs a needle decompression. The doctor knows what he's doing. No, he doesn't. Janet's eyes widen. "Excuse me?" Inside, Hammond tries to insert the chest tube. The patient convulses. The monitor alarm intensifies. "Systolic BP 60, a nurse calls out. "Sats dropping, 78%. Hammond's hands are shaking harder now. He pulls back. I need suction." Sarah pushes past Janet. "Hey." Sarah walks straight to the supply tray, grabs a 14-gauge needle, unwraps it. "What the hell are you doing?" Hammond shouts. Sarah doesn't answer. She moves to the patient's left side, palpates his chest, finds the second intercostal space, mid-clavicular line. "Stop her," Janet yells. Kyle stands frozen in the corner, watching. Sarah's voice is calm, steady. "If you don't decompress him, in the next 20 seconds, he's going to code." Hammond stares at her. His face is red. "You're a tech." "I'm right." The monitor flatlines. Asystole. Silence. Then chaos. "Start compressions," Hammond yells. Sarah moves before anyone else can. She positions the needle. Inserts it smoothly, perpendicular to the chest wall. Through skin, muscle, pleura. A hiss of air releases. Loud, unmistakable. The patient's chest expands. His body jerks. The monitor beeps. Once, twice. Sinus rhythm. Sarah withdraws the needle, steps back. The patient gasps. His oxygen saturation climbs. 82, 87, 91. The room is silent, except for the sound of the monitor. Every eye is on Sarah. She sets the needle on the tray, wipes her hands on a towel. Her face is expressionless. "He'll need a chest tube now," she says quietly. Left side, 5th intercostal space. Hammond stares at her. His mouth opens, closes. Kyle is still frozen. His eyes are wide, disbelieving. Janet steps forward. Her voice is sharp. "Who the hell do you think you are?" Sarah doesn't answer. She walks toward the door. "I'm reporting this," Janet calls after her. Sarah keeps walking. She pushes her cart down the hallway. Her hands are steady. Her breathing is even. But inside, something has cracked. She stops at the supply closet, steps inside, closes the door, leans against the wall. Her chest rises and falls, faster now. She looks at her hands. They're not shaking. They never shake. Not anymore. But they remember. They remember every needle, every chest, every soldier who couldn't breathe. She closes her eyes. "Stay with me, Garcia. Stay with me, Lopez. Stay with me." She opens her eyes, breathes out slowly. The door opens. Kyle stands there. He doesn't say anything at first, just looks at her. "That was a combat medic move," he says finally. Sarah's jaw tightens. "Cess, I don't know what you're talking about." "Yes, you do." Silence. Kyle steps inside, closes the door behind him. "I've seen that procedure done once, in a documentary, about forward surgical teams in Afghanistan." Sarah says nothing. "You didn't hesitate. You didn't second guess. You just did it. I saw what he needed." Most people wouldn't have. She looks at him. Her eyes are hard, guarded. I'm not most people. Kyle nods slowly. No, you're not. He leads. Sarah stands alone in the closet. The fluorescent light flickers above her. She pulls the challenge coin from her pocket, stares at it. Night stalkers don't quit. She didn't quit. Not tonight. But tomorrow they'll fire her. And maybe that's for the best. She puts the coin away, picks up her cart, walks back into the hallway. The trauma bay is calmer now. The patient is stable. Hammond is inserting the chest tube. His hands are steadier. A nurse assists. Janet sees Sarah pass by. Her face is cold, angry. Sarah doesn't look at her. She finishes her shift in silence. Restocks, cleans, stays invisible. At 6 a.m., she clocks out, drives home, lies in bed, stares at the ceiling, and waits for the call. It comes at 9:47 a.m. Her phone buzzes. Unknown number. She answers. This is Ellen Frost, Director of Human Resources at Providence General. We need you to come in today. Sarah closes her eyes. What time? 2 p.m. My office. Understood. The line goes dead. Sarah sets the phone down, sits up. She knew this was coming. She walks to the closet, pulls out a clean shirt, jeans, puts them on, looks at herself in the mirror. For a moment, she sees someone else. Someone in a flight suit, helmet under one arm. Confident, unbreakable. That person is gone. She turns away, picks up her keys, and drives back to the hospital. The office smells like stale coffee and corporate neutrality. Ellen Frost sits behind a large desk. Mid-50s, gray blazer, crisp white blouse. Her expression is cold, rehearsed. Sarah sits across from her, hands folded in her lap, silent. Frost opens a folder, skims the contents, doesn't look up. Last night, you performed a medical procedure without authorization, without credentials, in direct violation of hospital protocol. Sarah says nothing. Frost finally looks at her. Do you understand how serious this is? I saved his life. That's not the point. It should be. Frost's jaw tightens. You're an ER tech, Miss Mercer. You restock supplies, you assist nurses, you do not perform invasive procedures on patients. He was dying. Dr. Hammond was handling it. No, he wasn't. Silence. Frost leans back in her chair, folds her arms. This hospital has policies, liability concerns. If something had gone wrong, we could have been sued. You could have killed that Nan. I didn't. That's not the point. Sarah meets her eyes, steady, unflinching. What is the point? Frost's face hardens. The point is that you overstepped, dramatically, and we can't have that. She closes the folder, slides a piece of paper across the desk. Your termination is effective immediately. Sarah looks at the paper, doesn't touch it. You'll be paid through the end of the week. Security will escort you out. Sarah stands, picks up the paper, folds it once, puts it in her pocket. Understood. She walks to the door. Frost's voice follows her. For what it's worth, I hope you find something more suited to your skill level. Sarah pauses, doesn't turn around. I already had that. I left it behind. She opens the door, walks out. The hallway is empty, quiet. Her footsteps echo on the tile floor. She takes the stairs down to the first floor, exits through the side door into the parking lot. The sun is bright, hot. She squints against it. Her truck is parked in the far corner. She walks toward it, keys in hand. Behind her, a distant sound. Low, rhythmic, rotors. She stops, turns. A helicopter appears over the tree line. Black, unmarked, military profile. It circles once, then descends toward the hospital helipad. Sarah's chest tightens. She knows that sound, knows that silhouette. UH-60 Black Hawk. She watches it land. Dust and debris swirl outward. The rotors slow but don't stop. 4 figures exit. 3 soldiers in tactical fatigues. 1 officer. Sarah turns away, walks faster toward her truck. She reaches it, opens the door, climbs inside, turns the key. Nothing. She tries again. The engine clicks, doesn't turn over. She closes her eyes, breathes, tries a third time. Click, click. Nothing. She rests her forehead against the steering wheel. Footsteps approach, multiple, deliberate. She looks up. The officer stands 10 feet away, 30-something, lean, sharp eyes. Name tape reads Torres. He stops, doesn't come closer. Sergeant Mercer. Sarah's hands tighten on the wheel. She doesn't move. Torres takes a step forward. I need you to come with me. You'll always be a night stalker. Sarah's jaw clenches. I'm done. I don't think you are. She opens the truck door, steps out, faces him. What do you want? Torres glances back toward the hospital, then at her. We have a situation. Convoy inbound. Soldier with severe polytrauma. TBI. Internal bleeding. We need the best. Call Walter Reed. You're closer, and you're better. Sarah shakes her head. I don't do that anymore. You did it last night. Silence. She stares at him. How do you know about that? Torres nods toward the hospital entrance. Kyle stands there, watching. He called it in this morning. Through veteran channels, word travels fast. Sarah's fists clench. I got fired. I know. Then you know I can't help you. Torres steps closer. His voice drops, calm, certain. That man last night is alive because of you. The soldier coming in deserves the same chance. There are other medics, not like you. She looks away, her throat tightens. Torres waits, doesn't push. Finally, Sarah speaks. Why me? Because you've been where he's been. You've seen what he's seen, and you know how to bring them back. She closes her eyes. Images flash. Faces, voices, blood. Stay with me. She opens her eyes, looks at Torres. When? 20 minutes. Sarah exhales, nods once. Torres gestures toward the helicopter. Let's go. They walk across the parking lot. The three soldiers fall in behind them. Silent. Professional. Kyle watches from the entrance. He raises a hand. Sarah doesn't wave back. They reach the helipad. The rotors are still spinning. The noise is deafening. Sarah climbs inside, straps in. The familiar vibration hums through her body. She hasn't been in a Blackhawk in 3 years. It feels like coming home. Torres sits across from her, hands her a headset. She puts it on. His voice crackles through. ETA 10 minutes. We'll brief you en route. The helicopter lifts. Smooth. Fast. The hospital shrinks below them. Sarah looks out the window. Watches the city spread out beneath her. Roads. Buildings. People who have no idea what's coming. Torres pulls out a tablet. Shows her a photo. A soldier. Young. 24. Staff Sergeant Luis Reyes. Clean cut. Smiling. IED strike. Helmand Province. 72 hours ago. He's been stabilized but he's critical. Head trauma. Suspected abdominal bleeding. We're bringing him stateside for surgery. Sarah studies the photo. Memorizes the face. Why not treat him overseas? Too unstable to wait. We need him on a table, now. She nods. Torres swipes to another image. Medical chart. Vitals. Labs. Blood pressure low. Hemoglobin dropping. GCS score of 8. Sarah's mind shifts. Automatic. Clinical. She's done this 1,000 times. The helicopter banks left. Descends. They land on the hospital helipad. Different side. Closer to the ER. The rotors slow. The door opens. Sarah climbs out. Torres follows. 2 ambulances are already waiting. Lights flashing. Engines running. The first one opens. Paramedics wheel out a gurney. Reyes. Pale. Unconscious. Intubated. IV lines running. Monitors beeping. Sarah moves without thinking. Steps beside the gurney. Eyes scanning. Pupils sluggish. Respirations assisted. Abdomen distended. She places her hand on his chest. Feels the rise and fall. Get him inside, she says. Her voice is different now. Steady. Commanding. They wheel him through the ER entrance. Staff freeze. Stare. Janet is at the nurse station. Her mouth opens. What is she doing here? Torres walks past her. Doesn't stop. She's with me. She was fired. Not anymore. They reach Trauma Bay 1, the same room from last night. Sarah moves to the head of the bed. Checks the tube placement. Listens to breath sounds. Diminished on the right. Possible hemothorax. She looks at Torres. I need an ultrasound. Now. A nurse hesitates. Now. The nurse runs. Dr. Hammond enters. Sees Sarah. His face goes red. What the hell is going on? Torres steps between them. She's running this. Like hell she is. The door opens again. A man steps inside. Tall. 60. Silver hair. 4 stars on his collar. General Raymond Kessler. The room goes silent. Kessler walks directly to Sarah. Stops in front of her. He salutes. Sarah's body reacts before her mind does. She straightens. Returns the salute. Old habits. Kessler lowers his hand. Extends it. Sergeant Mercer, thank you for coming. Sarah shakes his hand. Her voice is quiet. Sir. Kessler turns to Hammond. His voice is calm. Absolute. She has full authority here. Any questions? Hammond's mouth opens. Closes. He shakes his head. Kessler nods. Looks back at Sarah. Bring him home. Sarah meets his eyes. Nods once. Kessler leaves. The room is frozen. Sarah turns back to Reyes. Ultrasound, let's move. The ultrasound machine arrives within 90 seconds. Sarah takes the probe, applies gel to Reyes's abdomen, presses it against his right upper quadrant. The screen flickers. Dark fluid appears, free-floating. Unmistakable. He's bleeding into his belly, Sarah says. Her voice is steady, clinical. We need a surgeon, now. Hammond stands frozen. Dr. Patel is in surgery, won't be available for 2 hours. He doesn't have 2 hours. Then what do you suggest? Sarah looks at the monitor, blood pressure dropping, 72/48. She turns to Torres. Get me a surgical team, anyone available. Torres nods, pulls out his radio. Command, we need a trauma surgeon at Providence General. Immediate. A nurse steps forward, younger, confident. Dr. Chen is on call. General surgery, I can page him. Do it. The nurse runs. Sarah looks back at Reyes. His face is pale, lips blue-tinged. The monitor beeps faster. She places her hand on his shoulder, leans close. Stay with me, Reyes. His eyelids flutter, barely. His lips move, a whisper, barely audible. Night Stalkers. Sarah's chest tightens. She finishes it for him. Don't quit. His hand twitches. She takes it, squeezes once. I've got you. The door bursts open. A man in scrubs rushes in, late 30s, glasses, focused. I'm Dr. Chen. What do we have? Sarah steps aside, hands him the ultrasound probe. Blunt abdominal trauma, free fluid in Morrison's pouch and the splenorenal recess. Likely splenic or hepatic laceration. He's hypotensive and dropping. Chen scans quickly, nods. Agreed, we need to get him to the OR. How fast can you be ready? 10 minutes. Make it 5. Chen looks at her, doesn't argue. All right. He turns to the nurses. Prep OR2. Type and cross for 6 units. Call anesthesia. The room explodes into motion. Sarah stays beside Reyes, monitors his vitals, adjusts the IV flow, increases the pressure on the fluid resuscitation. Kyle appears beside her, quiet, respectful. What do you need? 2 more units of O-neg, and keep that blood warmer running. On it. He disappears. Torres stands in the corner, watching, silent. Janet is near the door. Her face is pale, confused. Hammond has stepped back. He's no longer in charge. He knows it. Sarah checks Reyes's pupils again, still sluggish. She inspects the breathing tube, secure, listens to his lungs, clear on the left, diminished on the right. She turns to a nurse. Get me a chest x-ray, portable, now. The nurse hesitates, looks at Hammond. Sarah's voice cuts through. I said now. The nurse moves. Hammond steps forward. His voice is tight. You can't just take over. Sarah doesn't look at him. I already did. You're not a doctor. No. But I've done this more times than you've done codes. Silence. Hammond's jaw works. He says nothing. The X-ray tech arrives, sets up the machine. Sarah steps back. The image captures. She reviews it on the monitor. Right lung field. Hazy. Fluid level visible. Hemothorax. He needs a chest tube before surgery, she says. Chen nods. Agreed. You want to place it? Sarah meets his eyes. He's serious, not challenging, trusting. She nods. A nurse brings the chest tube kit. Sarah opens it. Her hands move with precision, muscle memory. She preps the site. 5th intercostal space, mid-axillary line. Administers local anesthetic. Makes the incision. Blunt dissection through the tissue layers. Inserts the tube. Dark blood drains immediately. 500 milliliters. Then steady flow. Sarah secures the tube, connects it to the suction device. Reyes's oxygen saturation climbs. 89, 92, 95. She steps back, strips off her gloves. Chen watches her. Respect in his eyes. Where'd you train? Bagram, Kandahar, Helmand. He nods slowly. That explains it. The OR team arrives. 2 nurses, an anesthesiologist. They transfer Reyes to the surgical gurney. Lines and tubes carefully managed. Sarah walks beside him as they roll him toward the elevator. Torres follows. In the elevator, Sarah keeps her hand on Reyes's wrist, checking his pulse. Steady, weak, but there. The anesthesiologist adjusts the ventilator settings, checks the IV pumps. You his medic? He asks. I was someone's medic, Sarah. Sarah says quietly. The elevator opens. They roll him into the surgical wing. Outside OR2, Sarah stops. She's not scrubbed, not part of the surgical team. Chen pauses at the door, looks back at her. You saved his life. Twice. Just get him through surgery. I will. He disappears through the doors. Sarah stands in the hallway, The adrenaline is fading. Her hands start to tremble. She clenches them into fists. Torres approaches, stands beside her. You did good. She doesn't answer. General Kessler wants to speak with you. After. About what? I think you know. Sarah looks at him. Her eyes are tired, guarded. I'm not coming back. He's not asking you to. Then what does he want? Torres hesitates. To thank you, and to tell you the truth. What truth? About why we came looking for you. Sarah's brow furrows. Torres glances down the hall, then back at her. Reyes asked for you, by name. Her breath catches. What? 3 days ago, before he lost consciousness. She told the medic treating him that if he didn't make it, someone needed to find Sergeant Mercer, 160th SOAR, the one who saved his life in Helmand. Sarah's face goes pale. I don't? You do. Torres pulls out his phone, shows her a photo. A younger Reyes, 19, dust on his face, blood on his uniform, lying on a stretcher. Her hands, her voice. Stay with me, Reyes. The memory hits her like a punch. 4 years ago. Convoy ambush, 3 wounded, 1 critical. Reyes, femoral artery bleed, hemorrhaging fast. She applied the tourniquet, held pressure, kept him talking, rode with him in the medevac. He survived. She never saw him again. Sarah stares at the photo. Her vision blurs. He remembered, Torres says quietly. He never forgot. Sarah's hands shake. She presses them against her thighs. I didn't know. He wanted to find you. Thank you. But you disappeared. She closes her eyes, breathes. All this time, she thought she'd failed, thought the faces she couldn't save outweighed the ones she did. But Reyes remembered. He came back, and he asked for her. Torres puts a hand on her shoulder. You didn't quit, Sergeant. You never did. Sarah opens her eyes, looks at the OR doors. Behind them, a soldier fights for his life. Because of her. She straightens, wipes her face. How long is the surgery? 3 hours, maybe 4. I'll wait. Torres nods. The general will be in the conference room, 3rd floor. Tell him I'll be there, after. Torres leaves. Sarah sits down in the hallway, her back against the wall. She pulls the challenge coin from her pocket, looks at it. Night stalkers don't quit. She never did. She just forgot. 3 hours and 40 minutes later, the OR doors open. Dr. Chen steps out, exhausted, but his eyes are calm. Sarah stands immediately. He's stable, Chen says. Splenic laceration. We got the bleeding controlled. He'll need ICU monitoring, but he's going to make it. Sarah's shoulders drop. She exhales slowly. Thank you. Chen pulls off his surgical cap. You're the one who got him here alive. I just finished the job. He walks past her, toward the locker room. Sarah stands alone in the hallway. Relief washes over her. Then something else. Something heavier. Guilt. She saved Reyes today, but 4 years ago, there were others. Soldiers she couldn't save. She closes her eyes. Their faces return. Always the same ones. Garcia, Martinez, Thompson, Cole, Williams, Patterson. 6 names, 6 faces, 1 night. She opens her eyes, forces the images away. Torres appears at the end of the hallway. General's ready for you. Sarah nods, follows him. They take the elevator to the 3rd floor, walk down a quiet corridor. Conference room at the end. Torres opens the door, steps aside. Sarah enters. General Kessler stands by the window, hands clasped behind his back. He turns when she enters. Sergeant Mercer. Sir. He gestures to a chair. Please, sit. Sarah sits. Kessler takes the chair across from her. Not at the head of the table. Beside her. Equal level. He's quiet for a moment, studying her. You left the 160th 3 years ago, he says finally. Honorable discharge, exemplary record, Silver Star, 3 Army Commendation Medals, 274 combat missions. Sarah says nothing. You were recommended for the Medal of Honor, twice. Her jaw tightens. I didn't deserve it. The soldiers you saved would disagree. She looks down. The ones I didn't save wouldn't. Silence. Kessler leans forward. His voice softens. Tell me about Helmand. Sarah's hands clench. Sir, I don't... Please. She hesitates, then speaks. Her voice is low, controlled. Mass casualty event. Coordinated attack on a forward operating base. Mortars, small arms fire. We had 11 wounded. Critical. All at once. She pauses, breathes. I triaged, worked as fast as I could, but there weren't enough hands. Not enough time. Her voice cracks slightly. She steadies it. I lost 6. Garcia. Martinez, Thompson, Cole, Williams, Patterson. Doesn't interrupt. I couldn't stop the bleeding fast enough. Couldn't intubate fast enough. Couldn't do enough. She looks up. Her eyes are wet, but she doesn't cry. I saved 11. But I only remember the 6. Kessler nods slowly. Do you know what the report said? Sarah shakes her head. He pulls a folder from his briefcase, opens it, reads. Sergeant Sarah Mercer performed combat trauma care under sustained enemy fire for 6 hours. She triaged 11 casualties with limited supplies and no backup. She saved 11 lives that would have otherwise been lost. Her actions were directly responsible for the survival of every soldier who made it off that base alive. He closes the folder, looks at her. You didn't lose 6 soldiers, Sergeant. You saved 11. Sarah's throat tightens. It doesn't feel that way. I know. He sets the folder on the table, slides it toward her. This is from the soldiers you saved. She opens it. Letters, photos, handwritten notes. The first one is from a soldier named Davis. He's smiling in the photo. Wedding ring visible. The letter reads, You gave me a second chance. I got married last year. My daughter was born 3 months ago. Her name is Sarah. Thank you. The next one is from Lou. He's in medical school now. The note says, I became a doctor because of you. You showed me what it means to fight for someone. More letters, more faces. Hernandez, Jackson, Booth, Simmons. All alive, all thriving, because of her. Sarah's vision blurs. She closes the folder, presses her palms against her eyes. Kessler waits. Finally, she lowers her hands, looks at him. Why did you really come here, sir? Kessler leans back. Because Reyes wasn't the only one who remembered you. I did too. Sarah frowns. You saved my nephew, Kandahar, 2018. Lieutenant Brian Kessler, shrapnel wound to the chest. You kept him alive long enough to get him to surgery. Her eyes widen. She remembers. Young officer, 23, punctured lung. She rode with him in the medevac, held pressure on the wound for 40 minutes. He's a captain now, Kessler continues, stationed in Germany. He asks about you every time I see him. Sarah's voice is barely a whisper. I didn't know. You saved a lot of people, Sergeant, more than you realize, and they didn't forget. Tears slip down her face. She wipes them quickly. Kessler stands, walks to the window, looks out at the city. You left because you thought you failed, but you didn't. You carried the weight of 6 losses and ignored the victory of 11 saves. That's not failure. That's humanity. He turns back to her. I'm not here to ask you to re-enlist. I'm here to tell you that you don't have to hide anymore. What you did mattered. What you do still matters. Sarah stands. Her voice is shaking. I don't know if I can go back. You don't have to go back. You just have to move forward. She looks at him, sees no judgment, no expectation. Just respect. What do I do now? Kessler picks up his cover, puts it on. Whatever you want, but do it as yourself, not as someone pretending to be invisible. He walks to the door, pauses. Reyes will wake up in a few hours. He'll want to see you. Sarah nods. Kessler leads. She stands alone in the conference room. The folder sits on the table. She picks it up, holds it against her chest. For 3 years, she's carried the weight of 6 names. Now, she holds the gratitude of 11 lives. It doesn't erase the pain, but it balances it. She wipes her face, straightens her shoulders, walks out of the room, down the hallway, back to the ICU. Reyes is in room 4, intubated still, sedated, monitors beeping steadily. Sarah pulls a chair beside his bed, sits down. She takes his hand. It's warm, alive. You made it, she says quietly. Just like I told you. His fingers twitch slightly. Maybe coincidence, maybe not. She sits with him for an hour, watching the monitors, listening to his breath. A nurse enters, checks the IV, sees Sarah. Are you family? Sarah hesitates, then nods. Yeah, I am. The nurse smiles, leaves. Sarah looks at Reyes, this young soldier who remembered her, who asked for her, who refused to let her disappear. She squeezes his hand gently. Thank you, she whispers. For remembering, for reminding her. for bringing her back. She stands, places his hand carefully on the bed, walks to the door, looks back once, then leaves. In the hallway, Torres is waiting. How is he? Strong. He'll make it. Torres nods. The general left something for you. He hands her an envelope. She opens it. Inside is a single piece of paper, a job offer. Trauma consultant, 160th SOAR Medical Division. Civilian contractor. Training and operational support. No commitment, no reenlistment. Just an invitation. At the bottom, handwritten. The choice is yours. Always has been. Sarah folds the paper, puts it in her pocket. She looks at Torres. Tell him I'll think about it. Torres smiles. He'll be glad to hear that. She walks toward the elevator, presses the button. The doors open. She steps inside. As the doors close, she sees her reflection in the metal. For the first time in 3 years, she recognizes the woman staring back. The hospital looks different the next morning. Sarah walks through the main entrance at 7 a.m. She's not wearing scrubs. Jeans, white button-down. Her hair is down. She looks like herself. The security guard at the desk looks up, does a double take. Miss Mercer? She nods. He stands, extends his hand. I heard what you did. That was incredible. She shakes his hand. Just did my job. No, ma'am, you did a lot more than that. She doesn't know how to respond, just nods, keeps walking. The hallway is busy. Morning shift change. Nurses, doctors, techs. Several of them see her. Conversations stop. Eyes follow. A nurse approaches, older. Someone Sarah restocked supplies for dozens of times. You the one who saved that soldier. Dr. Chen saved him. I just stabilized him. The nurse shakes her head. That's not what I heard. She walks away. Sarah stands uncertain, exposed. Kyle appears from around the corner, sees her, grins. You came back. I was asked to. He walks beside her. Admin's been in chaos since yesterday. Director Frost is panicking. General Kessler made some calls. Let's just say your termination has been rescinded. Sarah stops. What? You've been reinstated. Promoted, actually. Senior trauma consultant. They want you training staff. She stares at him. I didn't ask for that. No, but you earned it. They reach the elevator. Kyle presses the button. There's a meeting. 3rd floor conference room. 9 a.m. Frost wants to talk to you. The elevator arrives. They step inside. Sarah leans against the wall. This doesn't feel real. Get used to it. You're not invisible anymore. The doors open on the 3rd floor. Kyle leads her down the hallway. Outside the conference room, he pauses. For what it's worth, I'm glad you're here. Thanks. He leaves. Sarah opens the door. Inside, several people sit around the table. Director Frost, Dr. Hammond, Janet, 2 other administrators, and Dr. Chen. Frost stands. Her expression is strained. Professional mask barely holding. Miss Mercer, thank you for coming. Sarah sits at the far end of the table. Says nothing. Frost clears her throat. We need to address what happened and offer our apologies. Silence. Hammond shifts in his seat. Doesn't make eye contact. Janet stares at the table. Frost continues. We made an error in judgment. We didn't recognize your qualifications, your experience. We reacted based on protocol rather than reality. Sarah's voice is calm, steady. You fired me because I saved a man's life. We fired you because we didn't understand who you were. You didn't ask. The words hang in the air. Frost flinches. You're right, we didn't. She sits down, folds her hands on the table. We'd like to offer you a position, senior trauma consultant. You'd be responsible for training ER staff in advanced trauma protocols, civilian and combat scenarios. Sarah looks around the table. And if I say no? Then we respect that. But we hope you'll stay. Hammond finally speaks. His voice is quieter than before, less certain. I was wrong. About you. About what happened in that trauma bay. He looks at her. Genuine regret in his eyes. You saved that man. I couldn't. And instead of thanking you, I reported you. I'm sorry. Sarah studies him. He means it. Apology accepted. Janet clears her throat. Her voice is shaky. I was the one who pushed for your termination. I thought you were dangerous. Reckless. She finally looks up. I was wrong, and I'm sorry. Sarah nods, doesn't speak. Frost pulls out a folder, slides it across the table. This is the formal offer. Salary, benefits, Your responsibilities. Take your time reviewing it. Sarah opens the folder, scans the contents. The salary is 3 times what she made as a tech. She closes the folder, looks at Frost. I have conditions. Frost nods. Name them. Every person in this hospital gets treated with respect. Custodians, techs, aides, security, everyone. No one is invisible. Frost doesn't hesitate. Agreed. I want mandatory trauma training for all ER staff, not just doctors, nurses, techs, everyone who might touch a patient. Dr. Chen speaks up. I'll support that. We should have had it already. Frost nods. Done. Sarah leans forward. And I want to say in hiring, if someone shows competence, they get a chance, no matter their background. Frost meets her eyes. You'll have it. Sarah sits back, thinks. This isn't what she expected, not what she planned. But maybe it's what she needs. I'll take the position, on a trial basis. 3 months. Frost extends her hand. Deal. Sarah shakes it. The meeting ends. People file out. Dr. Chen stays behind. He waits until the room is empty, then speaks. I looked you up. After yesterday, Sarah tenses. Silver Star, 274 combat missions. You were a legend in the 160th. I was a medic. You were the medic, the one everyone requested. She says nothing. Chen sits down across from her. I'm glad you're staying. We need people like you. I'm not a hero. No, you're something better. You're real. He stands. Leaves. Sarah sits alone in the conference room. Through the window, she can see the city. People moving. Living. Unaware of the fragility of it all, she thinks about Reyes, about the 11 soldiers in the folder, about Garcia and the others she couldn't save. She can't bring them back, but she can honor them. By doing what she does best, by refusing to quit. She stands, walks out of the room, down the hall, to the ICU. Reyes is awake. The breathing tube is out. His eyes are open. He sees her. His face changes. Recognition, gratitude, relief. Sergeant Mercer. She walks to his bedside, smiles, small but real. Just Sarah now. His voice is hoarse, weak, but certain. You saved me. Again. You saved yourself. You fought. He shakes his head slightly. I asked for you. I knew if anyone could get me through, it was you. Her throat tightens. You should have asked for someone better. There is no one better. She takes his hand, squeezes gently. You're going to be fine, full recovery. Because of you. Because of a lot of people. He closes his eyes, tired, but peaceful. Thank you. He whispers. She stays until he falls asleep, then quietly leaves. In the hall where Kyle is waiting. You staying? She nods. He grins. Good, we need you. I need this too. He walks with her toward the elevator. For what it's worth, I knew you were something special, from the start. You barely talked to me. I didn't need to, I just watched. The elevator doors open. They step inside. So what now? Kyle asks. Sarah looks at her reflection in the metal doors. She's not hiding anymore. Now I do the work. The doors close. The hospital continues around them. Lives saved, lives lost. The constant rhythm of survival. And somewhere in the middle of it all, Sarah Mercer has found her place again. Not as a soldier, not as a shadow. As herself, 6 months later. The ER at Providence General hums with controlled energy. Not chaos, purpose. Sarah Mercer walks through the double doors at 6 a.m. Navy blue scrubs. Consultant badge clipped to her chest. Hair pulled back, confident stride. A security guard waves. Morning, Miss Mercer. Morning. Inging Janes. She stops at the nurse station. Reviews the overnight log. 3 traumas, 2 codes, 1 save. Everyone accounted for. A young nurse approaches. Emily, 26. New grad, nervous energy. Miss Mercer, I have a question about the airway protocol you taught us. Sarah sets down the clipboard, gives her full attention. What's the question? If I can't visualize the chords, do I go straight to the bougie or try repositioning first? Reposition once, if you don't see them. Use the bougie. Don't waste time. Emily nods, absorbing, learning. Thank you. Sarah watches her walk away, confident now, capable. That's 3 new hires in the last 4 months, all trained personally, all thriving. Kyle appears beside her, coffee in hand. Morning. Ready for the lecture? Sarah grimaces. Do I have to? Yes. Hospital board wants an update on the trauma program. You're the face of it. I hate being the face of anything. Kyle grins. Too bad. You're stuck with it. They walk toward the conference room. The hallway is different now. Cleaner, brighter. Staff move with purpose. There's respect in the air. Small changes, but real ones. Inside the conference room, 20 people wait. Administrators, department heads, board members. Sarah stands at the front. No notes, she doesn't need them. 6 months ago, our trauma response time averaged 8 minutes. Today, it's 4. Our save rate has increased by 18%. We've trained 62 staff members in advanced trauma protocols. She clicks to the next slide. Photos of the training sessions. Every ER tech now has basic airway management skills. Every nurse can perform needle decompression. Every doctor has been recertified in ATLS. A board member raises his hand. What's the cost? $200,000 for equipment and training. But we've saved 14 lives that statistically wouldn't have survived under the old system. She pauses. Lets that sink in. You can't put a price on that. The room is silent. Then someone starts clapping. Others join. Sarah doesn't smile, just nods, sits down. After the meeting, Director Frost approaches. That was excellent. It was facts. Frost smiles. You've changed this place. I just did what needed doing. That's exactly why it worked. Sarah leads the conference room, heads back to the ER. A trauma alert sounds overhead. Motor vehicle accident. ETA, 3 minutes. The team mobilizes. Smooth, fast, practiced. Sarah pulls on a gown, gloves, stands ready. The ambulance pulls in. Paramedics rush through the doors. A woman, 30-something, unconscious, head trauma, unstable vitals. They wheel her into Trauma Bay 1. Sarah moves to the head of the bed, checks airway, breathing, circulation. Airways compromised. I need an intubation kit. A nurse has it ready before she finishes the sentence. Sarah intubates. Smooth, fast, first attempt. The monitor stabilizes. Dr. Chen enters, sees the situation under control, nods at Sarah. Nice work. Team effort. And it is. Everyone moves like water. No hesitation. No confusion. The woman is stabilized, sent to CT, then to surgery. She'll survive. Sarah strips off her gloves, washes her hands, breathes. Another life, another save. It doesn't erase the ones she lost, but it adds to the balance. She walks outside, takes a break. The sun is bright, warm. A helicopter passes overhead. Black Hawk. She watches it disappear into the distance. She thinks about the job offer from General Kessler. Still. Sitting on her kitchen counter, unsigned, she's thought about it, a lot. But she's not ready. Not yet. Maybe someday. For now, she's needed here. Torres appears beside her. She didn't hear him approach. You're getting sloppy. I walked right up. She smirks. I heard you at 20 feet. He laughs. Fair. They stand in comfortable silence. Reyes is stateside now, Torres says. Full recovery. He's back on active duty. Sarah smiles. Good. He asks about you. Tell him I'm fine. Torres hands her an envelope. He wanted you to have this. She opens it. A photo. Reyes in dress uniform, standing beside a hospital bed. A little girl in the bed, smiling, bald from chemotherapy. The note reads, You taught me to fight for people. Now I do. Thank you. Sarah's chest tightens. She folds the note carefully, puts it in her pocket. Thank you. Torres nods, turns to leave, pauses. The offer still stands. Whenever you're ready. I know. He leaves. Sarah stands alone. The city stretches out before her. Vast. Full of people. Full of lives. Fragile. Precious. Worth fighting for. She used to think she failed because she couldn't save everyone. Now she knows the truth. You can't save everyone. But you fight for each one like you can. That's not failure. That's humanity. She walks back inside. The ER is busy. A child with a broken arm. An elderly man with chest pain. A woman in labor. Life. In all its messy, beautiful, fragile complexity. Sarah moves through it. Calm. Certain. Present. A nurse stops her. Miss Mercer, can you check this IV placement? Let me see. She looks. Adjusts. Teaches. Good work. Next time go one size smaller for pediatrics. The nurse nods, grateful. Sarah continues her rounds. Checking. Teaching. Leading. This is her place now. Not hiding, not running, fighting. At the end of her shift, she sits in the break room. Quiet, empty. She pulls out the challenge coin, looks at it. Night stalkers don't quit. She never did. She just forgot for a while. But she remembers now. Kyle pokes his head in. You coming to the staff dinner? She looks up. I don't really do social things. You do now. Come on. She hesitates, then stands. All right, they walk out together, down the hallway, past the trauma bay, past the rooms where lives are saved every day. Sarah glances back once. This is where she belongs. For now, maybe forever, maybe just until she's needed somewhere else. But wherever she goes, whatever she does, one thing is certain. She'll never stop fighting. Because some people are born to heal, and some people are born to refuse to let others die. Sarah Mercer is both, and she's done hiding it. The hospital doors close behind her. The sun sets over the city. Another day ends, another life saved, another chance given. And somewhere, in the quiet space between heartbeats, a soldier breathes because she didn't quit. A child laughs because she didn't give up. A father holds his daughter because she refused to stop. She'll never know all their names, but they'll know hers. Sergeant Sarah Mercer, the night stalker who came home, not to rest, but to keep fighting, in a different uniform, with the same heart. The camera pulls back, the city glows, lives continue, and in the emergency room of Providence General, the night shift begins. Ready, trained, led by someone who knows what it means to fight. Not for glory, not for recognition, but because every life matters, every single one. Fade to black. The end.